1. If done correctly, benign positional vertigo exercises are a useful remedy for vertigo. That's true. Vertigo is often mistaken for a fear of heights. It is not a fear of heights. It is also commonly confused with feeling lightheaded, like you are going to pass out. Although the sensations can be somewhat similar, they are distinctly different. It can more easily be described as dizziness. Vertigo is defined as you feeling that you or your environment is moving when they are in fact not moving. It is the illusion of movement. 2. There can be many causes of vertigo. The most common cause is called benign positional vertigo (BPPV). Other causes include vestibular neuritis, Meniere's disease, and vestibular migraine. Vestibular neuritis is inflammation of a nerve that plays a role in communicating balance to the brain. Meniere's disease is a problem with fluid in the inner ear. It has many other symptoms and is very characteristic in the presentation of vertigo. Vestibular migraine is vertigo that is related to a migraine. 3. There are many different treatments for these different types of vertigo, but for benign positional vertigo it is best treated by benign positional vertigo exercises. BPPV is caused by small loose particles in the fluid of the balance organs of the inner ear. The loose particles affect the balance receptors, which in turn send aberrant signals to the brain. This results in the perception of movement without any movement actually occurring. Often poorly treated with drugs, benign positional vertigo exercises is most easily corrected with benign positional vertigo exercises when they are taught properly. BPPV has very distinct characteristics. The episodes of vertigo are brief and in general last under 10 seconds. It will feel like the room is moving around you. Nausea may or may not be present. The triggers of this type of vertigo are very predictable and include movements such as sitting up or lying down in bed, rolling over in bed, bending over like you were tying your shoelaces, and looking upwards. Masking the symptoms and providing a false sense of relief is often done with drugs, despite the fact that a safer non-drug option exists with benign positional vertigo exercises. Drugs are commonly given for the symptoms of BPPV. They provide a false sense of relief by desensitizing the nervous system and the feeling of nausea and vertigo. They do nothing to fix the cause of the vertigo, they only treat the symptoms. The use of benign positional vertigo exercises is the only way to correct the root cause of this vertigo. When performed properly, they are safe, effective, and quick-acting. Plus, they can be performed in the comfort of your own home. There is a specific way to go about performing vertigo exercises. To do the Brandt-Daroff exercise, you should follow these steps. Start in an upright, seated position. Move into the lying position on one side with your nose pointed up at about a 45-degree angle. Remain in this position for about 30 seconds, or until the vertigo subsides, whichever is longer. Then move back to the seated position. Repeat on the other side. People who use this exercise usually are instructed to do multiple repetitions of the exercise at least twice a day. So take the time to research and make sure you get your advice from a trustworthy source and learn the correct way to perform benign positional vertigo exercises, and this will ensure the best chance of fixing your vertigo. Yes, I'm happy to be here to fix your problem. Please click the link below, https://twisunnytips.com/curavertigo/.